You may have seen some patients who had yellowish discoloration of their eyes' skin, especially mucous membranes. Also, you may have seen newborn babies like that. In this video we are going to find out what causes this yellowish discoloration, how to treat this condition. So, you already watching MedCentral, let's dive right into the topic. This condition is called as jaundice. Jaundice, also known as hyperbilirubinemia, is yellowish discoloration of the body tissues resulting from the accumulation of excess bilirubin. This condition only occurs when there is excess amount of bilirubin. That means there should be increased production or impaired excretion. Normal serum level of bilirubin is 1 mg per deciliter, and jaundice appears when the bilirubin level exceeds 3 mg per deciliter. Sclera has high affinity to bilirubin due to their high elastin content. With further progress, skin will progressively discolor from lemon yellow to apple green, especially in long-standing cases due to biliverdin. Icterus is an essential clinical indicator of jaundice. Yellowing of skin-sparing sclera is due to carotenoderma, which occurs in the healthy people who consume excessive amount of keratin-rich food. There are two types of bilirubin. Those are unconjugated bilirubin, also known as indirect bilirubin. Conjugated bilirubin, also known as direct bilirubin. So, there are two main categories: unconjugated hyperbilirubinemia, conjugated hyperbilirubinemia. So then let's talk about the etiology of these two categories. Let's take the conjugated hyperbilirubinemia first. Defect in canalicular organic anion transport in Dubin-Johnson syndrome. Defect of sinusoidal reuptake of conjugated bilirubin in Rotor syndrome. Decreased intrahepatic excretion of bilirubin due to hepatocellular diseases such as viral hepatitis A/B/D, alcoholic hepatitis, cirrhosis, non-alcoholic steatohepatitis, Epstein-Barr virus, cytomegalovirus, herpes simplex virus, Wilson disease. Cholestatic liver diseases like primary biliary cholangitis and sclerosing cholangitis. Infiltrative diseases such as amyloidosis, lymphoma, sarcoidosis, tuberculosis. Sepsis and hypoperfusion states. Total parenteral nutrition. Drugs and toxins such as oral contraceptives, rifampicin, probenecid, steroids, chlorpromazine, herbal medicine such as Jamaican bush tea, kava kava, arsenic. Hepatic crisis in sickle cell disease. Pregnancy. Extrahepatic cholestasis caused by biliary obstruction due to cholelithiasis. Tumors like cholangiocarcinoma, head of pancreas cancer, acute and chronic pancreatitis, strictures, parasitic infections like Ascaris lumbricoides, liver flukes. Now let's focus about the conditions which causes unconjugated bilirubinemia. Excess production of bilirubin in hemolytic anemia, extravasation of blood in tissues. Reduced hepatic uptake of bilirubin in Gilbert syndrome. Impaired conjugation in high estrogen, Crigler-Najjar syndrome type 1 and 2, hyperthyroid. So, as we now have discussed about the types of jaundice, let's discuss about the pathology of the jaundice. Metabolism of the bilirubin mainly divides into three phases. Prehepatic phase, which is the production of bilirubin as a product of heme. Hepatic phase, where hepatocellular uptake and conjugation of bilirubin occur. Post-hepatic phase, where the secretion of the bile from hepatocytes and intestinal metabolism of and renal transport occurs. So, if there is dysfunction in or defect in prehepatic phase, results on elevated unconjugated bilirubin levels. Also, if there is a defect in post-hepatic phase, there will be elevation of the conjugated bilirubin. If the hepatic phase affected, there may be elevation of both unconjugated and conjugated bilirubin levels. Increased urinary excretion of urobilinogen can be due to increased production of bilirubin, increased reabsorption of urobilinogen from colon, decreased hepatic clearance of urobilinogen. There are 4 different patterns of intrahepatic cholestasis which can be identified by histology. They are cytoplasmic cholestasis, canalicular cholestasis, ductal cholestasis. These changes appear due to the detergent effect of the retained bile acids. In neonates, due to undeveloped blood-brain barrier, pathological increase in bilirubin may result in condition called kernicterus, which can be lethal. Kernicterus is a disastrous neurological sequelae of hyperbilirubinemia. So that's it for this video. We'll discuss the medical management of jaundice in the second part of this video. Until then, take care guys, and thank you for watching. Subscribe for more videos.
Artificial love, we just make it up.